Here is your question. Okay, if you have read and understood, considering your history taking station, kindly begin.
Hello, good morning. I'm Dr.
Good morning.
Kamaldin Ibrahim, one of the candidates for the exam. May I confirm your name and your age, please?
Yes, I'm Rachel Green. I'm 53 years old.
How would you like me to address you, please?
Mrs. Green, please.
Okay, Lisa Green. Nice meeting you today. Can you please tell me why you are here?
Doctor, I'm having this severe headache, and it is my second time. The first time I lost my consciousness and the headache started. So this is the second time, and now my husband brought me to you for the solution.
Oh, Lisa Green, I'm so sorry to hear that. Okay, so I will just ask you some few questions so that we can find out what the problem is. Is this okay by you? Can I go ahead?
Yes, but
Thank
could you
Lisa Green.
please dim the light for me?
Okay, so please, can we please dim the lights? So lights dimmed. Is that better for you?
Yes, much better than before.
Ask about the pain
thank you.
analgesic.
Are you feeling any pain at the moment?
I have some pain, but I have taken some painkillers, so that's okay.
Okay. Are you feeling any sickness? Are you feeling sick at the moment?
Which type of sickness you are asking, doctor?
Like if you feel like you want to vomit or you're vomiting?
No.
Okay, Lisa Green. Oh, so if I may ask, when was the first time you have this headache?
It's 2 days ago. After loss of consciousness, when I regained my consciousness, the headache started. And it is so severe that I couldn't open my eyes. And everything seems so blurred for me. But suddenly it goes away. But now, today, it come back again.
I'm sorry to hear that, Lisa Green. The headache, what part of your head does actually ache? Is it the front, the back, or the sides, or the whole of your head?
Especially in the back.
Okay, sorry about that. Have you had this kind of headache in the past?
No.
If you are to grade this, 1 being very mild pain and 10 being the worst pain ever you've ever had, what grade would you give it?
It's 8 or 9.
Oh, really? I'm sorry to hear that, Lisa Green. That must be serious. Okay, so can you tell me, do you fit at any moment? Do you have seizure?
No, not now.
Okay, did anything hit you in your head before this time? Do you have injury to your head?
Yes, doctor. 3 days ago, I fall over the street and hit on my head.
Oh, sorry about that. So sorry to hear that, Lisa Green. Okay, so do is there any time you have stiffness of your neck or pain in your
No.
neck?
No.
Do you have fever?
Yes. From yesterday, I have fever.
Oh, thank you for letting me know that. So since the onset of this, what exactly have you done since all this?
Sorry, I didn't get you, doctor.
As in, what have you taken any medications?
Yes, I'm taking paracetamol for that.
Okay, Lisa, great. If I may ask, can I ask you some personal, your past medical history?
Yes.
Do you have any medical condition that you're taking medication for?
No.
Have you had operation in the past?
No.
Okay, Lisa, great. Do you have anybody in your family have a similar illness?
Yes. One of my aunt died due to brain aneurysm.
Oh, sorry about that. Thank you for letting me know that. Thank you. Do you have any drug allergy?
No.
Do you smoke?
No.
Do you take alcohol?
Is it relevant, doctor?
Yeah, we need to know.
Okay. No.
Sorry about that. If I may ask, do you have idea what the problem could be?
I don't know. I'm thinking about some migraine or something I'm having.
Okay, after we're done with this, we'll have to do some we have to do some assessment, and we can say
Can
whatever it
you
is.
please summarize
Okay.
your history now?
Okay, thank you. I've interacted with Lisa Green, 53-year-old man who had sudden headache following loss of consciousness. She has a family history of brain aneurysm in her sister. If I have enough time, I would like to ask history about the concerns and expectations. I would like to ask history about the systemic. We also ask about the systemic review.
Okay. How do you plan to manage this patient?
After taking history, I'll need to examine Lisa Green, the general examination and a regional examination.
Yes.
I want to do brain CT scan.
Okay.
I want to do a complete blood count, electrolyte creatinine.
Yes.
I want to do C-reactive protein.
Okay.
I want to do ECG, that's electrocardiogram,
Okay.
and echocardiography. I want to do
what treatment or management or would you suggest for this patient?
likely the patient has either a subarachnoid hemorrhage, and I will need to invite the neurosurgeon to review, and patient might benefit from a craniotomy.
Before you jump on to craniotomy, what is the medical management that a neurological unit can
medical patient will medical management.
Yes.
Imodipine,
Yes.
giving an analgesics.
Okay.
Also be giving
and laxatives. And what else? IV fluid, and they'll be managing patient according to ABC manner or protocol.
Yes, ma'am.
Yes, this is the most important one. Then if it does not work, then they can go for craniotomy, or they'll discuss in the neurovascular MDT.
Thank you,
Yes.
ma'am.
Sorry, I forgot to ask you, what are the differential diagnoses that you'll consider? Subarachnoid hemorrhage that you mentioned. What other differential diagnoses
My
would you
differential will
think of?
include subarachnoid hemorrhage,
Yes, and
meningitis,
yes,
encephalitis, migraine, headache,
yes, increased
brain
intracranial pressure
tumor.
due to, yes. So for that, you probably would also have to do CSF tapping or lumbar puncture or something.
Okay, ma'am.
Good. Okay. Now the feedback. You did tell me how would you have completed if time would have been enough. But is that, are you sure, was that all that you had to ask? There were certain more questions, like you had to ask about the seizure or the blackouts, if patient had experienced any blackouts before.
And
If,
okay, I
yes,
didn't remember to ask that.
yeah, you didn't ask that. And if, because
She
these are
she
the,
she gave
sorry? Because these are the
yeah
differential
she
diagnoses
gave me
that,
the idea that she
yeah,
has a photo
yeah,
that she has photo sensitivity,
what,
so
yes.
I didn't bother to.
And then you could have asked about any sensory motor changes if patient has experienced with this headache, if there were any weaknesses of the arm or the leg, or if there were any sensory disturbance, or if there were any loss of consciousness, any history. And then you should have asked if there was any neck stiffness, or was it only patient was sensitive to light. You could have asked if patient has experienced any rash associated with it. You did ask about the severity, but then you could have asked about the exacerbating or the relieving factors, like does it get worse with coughing, or does it get worse at night, or does it get better in the morning, or do you wake up in the morning with the worst symptoms and it gets better during the day, to rule out intracranial tumor. Or and then you can also ask about if it's associated with the activities, or does it relieve when you take rest. So these are the basic questions that you could have asked in the presenting complaint. You did ask about the trauma, you did ask about the fever, could have asked about the radiation as well. And the character, I think you did ask, or you didn't ask.
No, ma'am.
No. Okay, so character, you could have asked what type of headache it is. Is it throbbing, or is it what type of excruciating, or and does it go anywhere? And you could have asked for this. Right, and then
Thank you,
past
ma'am.
medical history. Sorry, I'm not done. Wait, because this is very important. How you take history. You were asking about the past medical history and then family history as well. When you were asking about the social history, like the patient said, is it important to tell you if I'm smoker or not? So before you ask these kind of questions, so you have to give a little warning that is it okay? I can ask you some personal questions. And then patient says, yes, it's all right, you can go ahead. Then you can ask, who do you live with? Do you drink? Do you smoke, etc. Right. Thank you.
Thank you, ma'am. Thank you, ma'am.
Thank you.